There are several things that can cause you to wake up with headaches every morning. Today, I'm going to cover 10 of the potential root causes. It's really important to figure out the root cause for your morning headaches because some of these things can lead to other health problems. For example, the first one, sleep apnea. This happens when someone stops breathing multiple times in the night. It leads to poor oxygenation, and then that will cause the blood vessels in the brain to dilate, and that can cause a headache. This is really important to figure out, though, because sleep apnea is also linked with cardiovascular disease, cognitive decline, high blood pressure, mood disorders, especially anxiety, and fatigue because you're just not getting good rest at night. Number two is high blood pressure. So we naturally get a rise in stress hormones like cortisol in the morning. We actually have the cortisol awakening response, and that helps to give us that burst of energy so we can get up and get going for the day. But in some people, that burst of stress hormones can cause high blood pressure. Number three is blood sugar dysregulation, especially if someone has blood sugar drops in the night or hypoglycemia. The body's backup mechanism to get blood sugar back into the normal healthy range is to spike cortisol. Now you layer that on top of the cortisol awakening response in the morning, and we get this double whammy of stress hormone that will impact the blood vessels in the brain and be another potential cause for headache. Number four is dehydration and electrolyte imbalance. Now, some people are truly just constantly dehydrated. They're not drinking enough fluids. Some people are drinking enough fluids, but they're not getting enough of the right electrolytes and minerals. And then, of course, if someone's drinking alcohol, that will cause both dehydration and electrolyte imbalance. So definitely consider those things if you're having morning headaches. Number five is jaw clenching and teeth grinding. Now, these things can also be signs of sleep apnea, so think about that. But just the tension from all the clenching and grinding can lead to a tension headache. Number six is sleep position. So again, if your neck is kind of twisted or torqued or not in the right position, that will also lead to muscle tension, in some cases nerve irritation, again, potential headache trigger. Number seven is histamine. So I work with a lot of people that have trouble either making too much histamine or breaking down histamine. Histamine has a circadian rhythm, and so for some people that can be a trigger. Histamine does impact the blood vessels in the brain and causes vasodilation. Number eight is chronic infections. So this isn't considered a common cause for morning headaches, but I have seen this in some of the patients I work with that have Lyme disease or co-infections like Bartonella. Number nine is caffeine withdrawal. So, just waking up in the morning, if we have caffeine withdrawal, that can impact the blood vessels in the brain, which can also be a headache trigger. And then number 10 is medications. So things like sleep aids or NSAIDs, other pain medications, we can have that rebound effect in the morning, again, as a headache trigger. So if you're someone who struggles with morning headaches, definitely, investigate this, try to figure it out. And if you can't figure it out on your own, I highly recommend working with someone, especially in the case of sleep apnea. It's just so important for your health to figure that out if that's a root cause. So thank you so much for watching today. I hope you found this helpful.